Yes, my name is Claire Kisirisa Kasumba, and I'm the in charge of this health facility, Kyebe Health Center 3. We have services offered here, a number of them, general OPD, and dental services, delivery services, maternity services, laboratory, HIV, care and arts, counseling, and family planning, etc. We have our maternity section on the other side of the road, as it may appear. It is this, and we have the general outpatient and other departments up there. We are faced with a number of challenges amidst our endurance in maternity section especially, and even other departments. Basically, we are improvising with the instrument and management of maternity department and deliveries, but the major problem is we do not have electricity. We find hardships in the light system and sterilization of our equipment, and any other activity that would necessitate electricity. We do not have piped water. We are just improvising with a tank of rainwater, which is seasonal. So when there is no rain, there is no water. So it is our humble appeal that we get some heavy high-gear solar system that could help us pump water from the nearby community, in the nearby pump, as in water catchment area, so that we could generate it and put up the tanks, the big one, so that we can have a consistency of running water. The power itself is in a mess. We do not have completely, and we request if we could have some hydroelectricity power. The staff quarters for the nurses, the midwives, are in a sole state. Each nurse is occupying a single room. Many times we even get staffs who decline the chance to work with us here in Kyebe because of the accommodation services, because of the accommodation facilities, which are totally poor. A single room, imagine, sometimes we even share two staff in one single room, which is also in a bad state. We do not have, amongst the departments that I've mentioned, we also need, because Kyebe is in a setup is a kind of hard to reach area, whereby in heavy rains, it is really difficult for a person to cross over from Kyebe to the nearby health facility, which is Kakuto Health Center, to access other medical services like the dental care health system. So what we would request is, if we could get equipment for the dental clinic, the doctors are willing to perform some procedures in the dental department other than sending away the patients, who in turn go back home and stay without any treatment. Sometimes they get worse and then get progress to other medical conditions that are grievous. And even our mothers, many times, they would rather deliver from home than coming to access medical care that is in such a sore state, where we just use a simple boiling method to boil our equipment as sterilization. As I already mentioned, that we do not have enough equipment and even power. So we find it difficult. We do not have other accessibility to eye care, that is the ophthalmic department. It is not there. But if it is upgraded and put in place, we can easily achieve our goal. we have a catchment. We have a catchment population that is really high. We even have foreigners. And a month, we expect to deliver around 120 mothers. But you find a few access it, and when we do a community diagnosis through our VHTs, the health unit management committees, they really tell us they cannot come to Kyebe because of its condition. That is not worthy a mother to deliver in. Maybe those are some of the reasons. And many times when power is off, we use our mobile phones and this lantern, whereby we buy kerosene, we load it, and then we use it to conduct a delivery, which is really very, very also unworthy and not medical. So this is what many times we have used to conduct our deliveries.